All right, y'all, so we have another video here. This is the lymphatic system, and we've talked about and we've touched on the lymphatics a couple of different times throughout the different videos, but I wanted to have just a quick video dedicated specifically to the lymphatic system. And what a better time to do that than during Lymphoma Awareness Month in September. So it's really important for us to understand what happens when this system gets overwhelmed. So when we talk about the lymphatics, we're talking about the lymphatic vessels, we're talking about the lymph nodes, we're talking about various tonsils, and also the thymus gland. So there's a number of different structures that we're familiar with when it comes to the lymphatic system. So the lymphatic system's primary function is to remove any excess fluid or to remove protein molecules leaked from the pulmonary capillaries. So we get this waste management system that is clearing house when it comes to removing waste and all of those extra protein molecules when the pulmonary capillaries get overwhelmed. The other thing is this is part of the immune system. It removes bacteria, it removes foreign particles and cellular debris. So it has numerous functions when we're talking about removing waste or unwanted bacteria or unwanted foreign materials. And then the last thing is it produces lymphocytes and monocytes. And we see these are actually white blood cells that are used to fight bacterial infections, and we'll talk about those more when we start diving into different lab values and things like that. But the lymphatic system, it is waste management system, and it produces lymphocytes and monocytes. When we look at the lymphatic system, it's an open system. What that means is it ties into other systems. So it'll pull that excess fluid, all of that bacteria, those protein mediators from the pulmonary capillaries, take it through its own system and then dump it into a completely different system. So it is not closed off to its own system. It actually ties into a number of different systems. Superficially, these structures are found in the visceral pleura, and then whenever we start to dive deeper into the dense connective tissue, this it wraps around bronchioles, it wraps around the bronchi, and then also the pulmonary arteries and the pulmonary veins. So you see this out in the visceral space, and then you see it down deep in the deep connective tissue. So we've got the lymphatic system that is encompassing and is tailoring to all different areas of the pulmonary system. When we look at the structures of the pulmonary lymphatics, we see that they are these leaflet, the single leaf funnel shaped valves that move all of that extra fluid, all of that unwanted material into different areas of circulation. And the way that it moves fluid or that unwanted material is through peristalsis. Peristalsis is that kind of wave-like movement that moves food through your digestive tract. So it uses the same movement to do that. So we have the peristalsis and the movement of that fluid. That's part of the autonomic systems. That is something that is automatically happening. That's not something that I have to think about. Okay, body, I need you to drain my right lower lobe because I feel like there's a lot of fluid that's taking place there. Lymphatics, you guys are up, you need to remove that. No, I don't have to think about that. That is something that is automatically happening through the autonomic system. Now, another thing that takes place that aids in the movement of that fluid is this change in your thoracic pressure. So every time you take a deep breath in, it changes the thoracic pressure. And then every time you take a breath out or you exhale, it changes it again. So every time you breathe, you're changing the pressure inside the thoracic cavity. And what that does is that helps aid and helps move that fluid or that unwanted material through the lymphatic system. When we look at lymph nodes themselves, there are thousands, if not millions, of these tiny nodal developments that is an organized collection of lymphatic tissue They're designed to be filters to keep particulate and bacterial matter from entering the bloodstream. So this is part of that immune system, that filtration system that is looking at, is there a foreign body, is there a particulate or a bacteria that could harm the patient by entering the bloodstream. So what it does is it filters that bacteria before it can get to the bloodstream. And this is actually where we get the site for those lymphocytes and those monocytes. So again, these are big portions of the filtration system and the immune system that will help prevent bacteria from getting into the bloodstream. And when we look specifically at the alveoli, there are not any lymphatics within the alveoli. What we have are called these juxta-alveolar lymphatics. And what that is they are right next to, they sit up against, they are adjacent to, they're adjacent to the alveoli. Not within it, but next to. But what these juxta-alveolar lymphatics do is they remove excess fluid and debris from the interstitial space. So we get these structures that are moving fluid away from the interstitial space. There's actually nothing inside the alveoli that's removing that. They're all found in these juxta-alveolar lymphatic regions. So that extra fluid that builds up in the interstitial space is removed through the juxta-alveolar lymphatics. Now the pathway from the interstitial space goes from the interstitial space to the thoracic duct. From the thoracic duct, it goes to the left brachial vein. From the left brachial vein, it moves into the superior vena cava and then is eliminated through waste once it passes and gets into systemic circulation. So we do not necessarily see alveoli that have their own lymphatics. We utilize these juxta-alveolar lymphatics that removes excess fluid from the interstitial space. From there, it gets dumped into the thoracic duct into the brachial vein, all the way into the superior vena cava, which then gets circulated in systemic circulation, is then eliminated in waste. So when we look at conditions like pulmonary edema, we need these juxta-alveolar lymphatics to help us eliminate that extra fluid, which will eventually be excreted in the waste. Now, when we talk about where we have lymphatics in association with the pulmonary system, we have to understand that it's going to be different in different regions. If you remember when we talked about the different zones when it came to pulmonary circulation, we had 3 different zones, and I'm going to use my little box here, and this is zone 1, zone 2, and zone 3. Where did we see most of the circulation at when it came to zone 1, 2, and 3? Yeah, we have more circulation that takes place here in zone 3 than we have in zone 1. Up here we have more alveoli that are a lot larger in zone 1, and in zone 3 we have more circulation. When we talk about differentiating the bases from the apices, we have to recognize that there is going to be a difference in our lymphatics. Where would you think that there would be more of an emphasis when it came to the lymphatic system? Would you see that more in the apices, or would you see that more in the bases? Definitely, you're going to see that way more than what you would see in the upper lobe or the apices. Now, when we look at the left lung versus the right lung, one of the things that we have to kind of differentiate is there a difference between the left side and the right side? Is there really a difference when it comes to lymphatics on the left lung versus the right lung? And I'm going to tell you that when we look at it, there are actually more lymph system, there's more of a lymph system, there's more lymphatics, there's more of a debris removal system on the left side than there are on the right. So when we look at patients that perhaps have a bilateral pleural effusion, when they have a bilateral pleural effusion, my question to you is, which side would drain faster? Yeah, if you have more lymphatics on the left side, that left lung is going to drain faster than the right side. So when you have patients that have a bilateral pleural effusion, if you take close notice, you'll see oftentimes that that right lung has just a little bit more fluid than the left lung does. And we think that that is because there is more lymphatics here on the left side than there are on the right. So that is important when it comes to side is going to be drained more effectively or more efficiently than the other. Just some things that we have to understand when it comes to the anatomical structures and the anatomy of the lymphatic system. When we have the lymphatics that actually break down, I love this video here. This is Beaker that is like freaking out that there was a larger fire than what should have happened with his little experiment here. So the question that I have for you guys is, what happens when the lymphatic system cannot keep up with the excess fluid? What happens when things go awry, when they go astray? So if we look at this chest x-ray, we can see a couple of different things. Well, based on the highlighting here, we have a metallic mitral valve. We have sternectomy wires. So this patient has had some sort of cardiac surgery to repair or even really to replace this mitral valve. So when we have the lymphatic system that cannot keep up with all of the excessive fluid or all of the fluid that's being pumped through, what happens when we didn't have this mitral valve that was working as effectively as it is? Well, then that blood, that fluid is going to back up from the left ventricle into the left atrium. From the left atrium, it's going to go into the pulmonary veins. From the pulmonary veins, it's going to go into the pulmonary venules. From the venules into the capillaries. Remember, we have a tennis court's worth of pulmonary capillaries, but what happens when those get overwhelmed? We normally have 60 to 80 mLs of volume in that, and they can expand up to 200, but what happens when those get overwhelmed? Well, that fluid's going to move into the interstitium. The fluid in the interstitium is then going to move into the alveoli, and then from the alveoli, we're going to see that it can lead to fluid into the pleural spaces as well, and we get pleural effusion. So there's a number of different things that can happen, but when we look at this chest x-ray, we have what's called blunted costophrenic angles. Costophrenic angle is the angle of the diaphragm to the thoracic cavity, and it should come to this like 35 to 45 degree angle. But when we look at this, this is way more than a 35 to 45 degree angle. Same thing over here. This looks almost flat, like a 90 degree angle, showing that there is fluid in that pleural space. So if we were to get really particular about this image, about this chest x-ray, we see that there's more fluid here on the right side than there is on the left. Again, that is because, or the thought process is because there are more lymphatics on the left side than there are on the right. When we start looking inward to the pulmonary vasculature, we see that that pulmonary vasculature is really overwhelmed with a lot of fluid. And we see that there is a large amount of pulmonary congestion, and we see that there's actually kind of a shape to this congestion. And when we look at that shape, I'm going to keep that up there. I'm going to draw that, and I'm going to try to do a good job of drawing that, but I'm going to keep that up there. When we look at it, that shape can be described as a butterfly wing or a bat wing appearance in that pulmonary congestion. When we see that, that's a good indication that that patient probably has, their pulmonary system has been overwhelmed and they could have pulmonary edema. Now, some of the other things that we need to look for When we look for x-rays that are like this, we need to look for curly A, B, and C lines. So when we look at curly A lines, these are diagonal or vertical lines that we see within the pulmonary vasculature. When we look at the curly B lines, these are horizontal lines that we see into the vasculature that are showing that there is an excessive amount of fluid, or what we call pulmonary congestion. When we look at curly C lines, these are actually kind of a curved shape or a circular shape that go around the alveoli. It is showing you that that alveolus that has the pulmonary capillaries, that you can see the congestion within the pulmonary capillaries. So differentiating curly A, B, and C lines, these are just simply shapes that appear when we have patients that have pulmonary congestion and the lymphatic system has been overwhelmed. So, quick overview of the lymphatic system. Be sure that you know how this works, what the purpose is, and what happens when the lymphatics get overwhelmed. We have an entire lung unit or a pulmonary system that can get overwhelmed, and we can see that it leads to lingering problems. If we were to look at this patient here, what do you think their breath sounds would sound like? If you were to look at this patient here, you were to assess this patient, what position would they sit in to be the most comfortable? A complaint that might be familiar with this patient would be paroxysmal nocturnal dyspnea. What does that mean? That means that this patient struggles when they are going to sleep. They struggle breathing when they lay down, and they have to sit up almost in a recumbent or a recliner position just to breathe. When we think about the dysfunction and how the anatomy works and what happens when it doesn't work, what I want to challenge you guys with is, what will your patient then present like? So we can start taking the concepts of anatomy, what happens, what's its primary function, or what's the function of the anatomy, what happens when it becomes dysfunctional. That's great, but the question is, how will your patient present? And that's what I really want us to get when it comes to the anatomy of all of these structures.